Hello, welcome to news tutorial presented by DASSI SchrDbb. In this tutorial, you're going to see physical examination instruments. So, for the physical examination instruments, you need to know that you have to prepare yourselves with these different things that are on the table. To start with, we have these. Inside, we have the pen touch. So the pen touch is here to show up light. The second instrument is the tongue depressor. This is the tongue depressor, which is used to bring down the tongue and also touch the uvula. The next instrument that we have is the pulse oximeter. For the pulse oximeter, you put it on, you place it on your finger, and then it's going to read up the value. The next instrument that we use, these are disposable gloves. So they are very simple to put on, as contrary to the other gloves, which are the sterile gloves. You see, the sterile gloves is sealed to show that it's actually very sterile and there is no microorganism inside these gloves. And to go up, you have to continue to the videos in order to visualize how to wear the sterile gloves. For protective measures, we have the face mask, which is used to prevent contact from any airborne diseases with the patient. The next one, we have a syringe. If you're a patient that has a pus anywhere, you can just take it in order for you to drain it and find if there is any presence of pus. And for the next instrument, we have this. This instrument is called the patella hammer. Now, the patella hammer, it has different names. In this form, it is called a screen square hammer. But when you convert it from this position, like this, to this position, like this, it's now called a Babinski hammer. The next instrument is the thermometer, particularly called the mercury in glass thermometer. It can be placed orally, it can be placed axillary, or it can be placed rectally in order to have a temperature which is normal body temperature of being between 36.5 to 37.5. The next instrument is the tuning fork. The tuning fork has two ranges that is written on it. We have the 250 Hz tuning fork that is written on it, and we have the 500 Hz tuning fork that is written on it. The 500 Hz is used for audition test, while the 250 Hz is used for vibration sense. The next instrument is this. This is the otoscope. The otoscope, as you can see, I just opened. The otoscope, it is having a visual part that you place your eye here, and it has a luminary part, an optic part, where light comes from here. As you can see, you can put it on and off. You see how it's getting on and off. And then with the otoscope, there are different cones which can enter in up into each otoscope. Each cone can get entered, and then it can help you to pass inside the external auditory meatus in order for you to visualize the tympanic membrane. The next instrument after that, we have the glucometer. As you can see, my glucometer is still closed. We have the glucometer. The glucometer is made up of these, which are the strips of the glucometer. These are my strips of the glucometer, as you can see inside. These are the strips of the glucometer. And this is the glucometer. The strip of the glucometer enters in here, as you can see, and then you put in some blood. And then after that, you need to know that you take up some blood of the patient with this. And these are the stylet. The next instrument is this, the stethoscope. The stethoscope. The stethoscope is helping in auscultation, and it's made up of the diaphragm with the bell, and then the auscultatory part with the ears. The next instrument on our table is the measuring tape, extremely important in obstetric and gynecology and pediatrics and other surgical pathologies. The next instrument is your fetoscope. The fetoscope is also called a penile stethoscope. This is the portion which is in contact with the abdominal part, and this is the portion that is in contact with the ear. And then the last instrument of our table is this. As you can see, it's still sealed, but I'm going to open it for you. So this is called a vaginal speculum. This is a vaginal speculum that is used in a vaginal examination for inspection. Put in and then you open up to visualize the cervical external os. This is a vaginal speculum, particularly a cusco vaginal speculum, which is plastic one.